In other updates from some of our top stories that did transpire during the week, we saw the United Nations Development Programme this week partnering with the Ministry of Health, Culture and religious leaders to scale up the national Ebola response. This was during the high-level engagement on leveraging partnerships for public health emergencies held at the UNDP offices here in Kampala. UNDP is working with the Ministry of Health, the World Health Organization, the Inter-Religious Council of Uganda, Buganda Kingdom, and Kampala Capital City Authority to improve standards of care and strengthen public health, risk communications, and community engagement with emphasis on risk groups such as border riders and other vulnerable populations.
First of all, we are still in Ebola, even if we have made some great strides in there. And therefore, from a response point of view, there is still more to be done because the country is not yet declared Ebola free. And from where we sit at UNDP, we feel that as a development agency and the largest development agency within the United Nations system, there's a strong interconnection between health and development, and therefore this is why we are coming in very strongly.
They're still in our custody, about 400 something, and they are being handled and others are being discharged. They don't have Ebola. And we pray that by the end of, or by mid-December, we don't have any cases or any contacts that we are still following up. Once these test negative, we shall have no more cases. At least by next year, we pray that we be declared Ebola free.
Honorable Margaret Muhanga, the Minister of State for Health, in charge of primary health care, commended UNDP for partnership with traditional and religious leaders in supporting the national EVD response.
I want to thank the religious leaders. I want to thank Obwakabaka bwa Buganda for the interventions. I want to thank all our development partners, WHO, UNICEF, all those who have come in to assist the ministry, also the US Embassy. They've come in to assist the ministry to fight against Ebola, and especially on communication. People got this information and really adhered to the SOPs in Kasanda and Mubende. That's why you have seen we've fought it in record time of 3 months. It never happens anywhere in the world.
Excited about this partnership. We believe that other key stakeholders can leverage a lot from utilizing our countrywide faith institutions that enjoy unrivaled influence and are empowered with grassroots structures, dedicated leaders with a wide range of spiritual resources that instill their followers with a sense of responsibility and a hope in challenging circumstances.
United Nations Development Programme, we are very delighted to provide support in many different facets with state and non-state actors in the response to Ebola, but importantly to strengthen health systems into the future.
UNDP resident representative Ms. Elsie Atafor underscored the role of traditional leaders and faith institutions in influencing behavioral changes and cascading EVD messages using their structures.
We are also working very strongly with the Ministry of Health on a number of fronts. Today we presented some washing machines because in the Ebola space you need to also prevent Ebola from moving forward, and washing machines are very important because we are giving the industrial ones to the health centers as well as incinerators.
Provision of heavy-duty washing machines and incinerators to support infection, prevention and control and deployment of specialist UN volunteers to support the national Ebola response in high-risk areas has been prioritized. Sandra Kahunde, UBC News.